Dr. Kim Chi and al. Demonstrated in a subgroup analysis of the TITAN trial that patients who achieve a PSA of 0.2 anytime in their disease course have higher overall survival values than those who do not on ADT plus apalutamide. For this reason, we sought to validate these findings in a real-world population cohort at the Huntsman Cancer Institute. So our study included 134 patients that received intensified ADT with either docetaxel or novel hormonal therapy. 30 of these patients did not achieve an optimal PSA response of 0.2 or less. So baseline characteristics between the two groups were similar, except for a higher median baseline PSA in those who do not achieve an optimal response. PFS and OS were significantly lower in this small population subgroup. Our study included 134 patients with MCSPC who received intensified ADT with either docetaxel or novel hormonal therapy. Out of these, 30 did not achieve an optimal PSA response of 0.2. Baseline characteristics between optimal responders and non-optimal responders were similar, except for a higher median baseline PSA. Progression-free survival and overall survival were significantly lower in patients who do not achieve this optimal response, showing that these patients might have a more severe disease course. We also tried to characterize these patients genomically. However, we did not find any relevant difference in between these two groups. Our next step would be to identify some driver pathways in this very special subgroup of patients with very aggressive disease. Our next step would be to perform gene expression profile in this subset of patients with the possibility to identify some specific drivers of disease and pathways, which might help identifying new drug targets.